everything all set up here.
There was a hand sanitizer on
I
there.
know. Last night we were doing Vita Bunches. Okay, I'm going to clean the room, wash my hands. Hello there. How are you today? Now, if she is cuffed, her trach is cuffed, can she talk?
No.
No. So hers is cuffless, so she could talk. She goes, well, I'm doing okay. Okay, well, you know what I'm going to do? I'm going to change that dressing. It looks like it needs some changing. Is that okay? Sure. Okay, can I have 2 forms of ID? And her name is Shanae, the JJ, 102650. Okay, Shanae, well, that's what I'm going to do. My name is Cheryl, so I'll be doing that for you. So just let me get set up here first, okay? All right, so she has a trach, and of course, I have, what is this called? Does anybody remember? It's called an obturator. An obturator, it was on the PowerPoints that we did. And what happens is, if somebody doesn't lock the inner cannula in, and it's just very loosely there, and she coughs, it goes, because there's a lot of air there. And you're there, what you do is you take that off right away, and you put it in, so it keeps the airway from clamping up or spasming, closing off. So you have to have this at every bedside of anybody who has a trach. But hers is in. And this is the inner cannula. Now, if they teach you to clean that, that's okay, but this has to be done sterilely. That's an opening right into the lung. This has to be sterile, and there is an intricate way of doing it. It's like you can't hold it here, but hold here. Then it's very intricate. There's usually a kit that you get that comes along that you use to clean this. A lot of times respiratory will do it, but sometimes they'll let the nurses do it. So then you just put it right back in, kind of takes a little bit like this, and then it should snap in. Yep, there it is. It'll snap in, and then that means it's fine. That is still an opening directly to the lung. You have to be very careful because I'll tell you, anybody who has a trach probably has an infection in their lung. There's just no way that you can get around it. It's just easy access for any bacteria, but you have to keep as strict medical asepsis as you can. You're never going to be sterile because you are dealing with skin, secretions that are already probably infectious that are coming up from the trach itself. This is a trach collar, and this, I love the Velcro one, but I am going to show you how to use this. These are twill tape that you will sometimes see. I don't want you, and this comes in a lot of your kits, so I don't want, for cleaning, I don't want you to come across it and they go, here, put this on. I don't even know how this even works. So I want you to know how it works, and I'll show you. So I will be taking this one off, putting this one on so I could show you. And then I'll put that back on again. So for your purposes, when you show me, it will be the same. You'll have the Velcro on. You're going to have to show me how to use the twill tape. When you're done, put it all back together again. Don't leave this on. Your responsibility is to leave it as it was at first. And I don't know why I have these. Just put it back on.
So question, Cheryl, that thing that you got up there, that you got taped up there? I forget what you just called that.
Obturator.
Yeah. So would that always be taped up there? Or would
Should
that
be.
Wouldn't it be like a sterile dressing thing because you're sticking it in there?
Yes, it would be. But see, I don't have the whole.
So it would be packaged.
It's in a package.
Okay.
And then you put it up there. Yeah, otherwise.
Yeah.
Oh. So yeah, it's already in a package, but I don't have the package for it. So you just have to pretend, you know.
And then if you ever had to clean the cannula, would you use the obturator?
No, you don't have to at that time. It's like if they're having a coughing spasm and it goes, and it's spasming. Remember when I did? It's just spasms. You can't even hardly get air in. And you don't want to close it off because that is their only access to life there. So, no, when you're doing it, you don't have to put the obturator in. Unless they're having a coughing spasm, and it might help. But I've never had to. And I've had to clean them. And like I said, I'm not a mucus person. Okay, usually this is on as well. So I'm going to put it on. This gives them supplemental oxygen. So they'll have this connected to the corrugated tubing, which will give you oxygen. And so because they need that extra, because already they're probably full of mucus and secretions and infection. So that's what you'll usually see. So I'm going to get everything ready. I don't have to put gloves on yet. I'm just going to put this right here, Shanae. It's okay, so I can throw that. This is for later. Oh, I should at least package. Let me get my two little sterilization things. Hydrogen peroxide, saline. No, my saline is going to be my full one. My little one is going to be my hydrogen peroxide. And I'm going to use 2 4x4s and my new tea sponge dressing. And cotton tipped applicators. And I have a whole bunch of opened ones in there. So you new people, try and use opened ones until you get for your test out. Your test out, you'll get a brand new one. This will not be opened. And you can have opened 4x4s. And you can have one that isn't open, and whatever else you have can be open. Just so I can see that you know how to do that. Okay, so what I'm going to do first is get everything set up. I'm going to remove the old dressings first. Or dressing. Okay, I'm just going to take that dressing off. Okay, Shanae? I'm going to look. She's probably got an oxygen monitor. I'm looking to make sure if she had her O2. So you're going to put the oximeter on. I have plenty. And of course, if it registers something, I would run because she should not be registering anything. and you put it on there and you want to make sure. Now, if she's this bad and she has trouble breathing, you're probably not. Remember what is the average O2 sat?
85 to 80. No.
Average O2 sat for normal people. I hate normal. 95 to 100.
Yeah,
okay, should be.
What you said.
For COPDers, 89 is probably 89, 90 is about as good as you're going to get. Otherwise, you're going to be standing here forever and taking a nap and everything before she ever reaches that point. So any COPDer, it's okay. The doctor will usually say if below 89% or 88, then you might need to do a little suctioning in there. But otherwise, that's what you want it at. She's on supplemental oxygen. She should give you at least that. Okay, I think we're ready to go. Now, I'm just going to take this dressing off. Now, everybody, I want you to put your finger right here, okay? And I want you to press and tell me what you feel.
Oh, yeah, it doesn't feel good.
See, no, I feel like I'm going to gag. Well, that's what they feel.
Constantly?
No. No. When you're doing the changes of everything. Because you're messing around here.
Okay.
And it doesn't feel good. So just remember that when you're doing it. Okay, now, Shanae, I'm going to be doing that dressing change. You know, that's kind of a little uncomfortable for you. But I'll try not to put a lot of pressure. And so I'm just, first of all, I know this doesn't hurt. I'm going to take this old dressing off. Sometimes, this is called a faceplate inner cannula. And sometimes this faceplate is a little bit sutured. Just depends on what the doctor wants. Most of the time it isn't. So you have to be careful. Okay, now I'm just going to put her oxygen right back on. Take some nice deep breaths every time I take that oxygen off, please, because I want you to be sure you're getting as much oxygen as possible.
Can you like open those up? Is that just like two different things? Or?
No.
Okay, that makes sense.
And that's the
and
tea
I'll tell you what
sponge?
respiratory calls them. Because these are the tea drain sponges. You can also put them for under Penroses. Remember we talked about Penroses? Mm-hmm. You can wrap it around the Penrose. They're used for other things too, but they're really good for trachs. But this is what they're called, pants. Respiratory therapy and everybody else calls them pants. So if they say, go get some pants, you're like,
I got pants on.
no, I'm not giving mine up. But anyway, those are pants.
She totally just removed the tube from her nose. Make it easier.
I know.
I think everyone tested off on that already. I think everyone tested off on that. No?
Nope. But I'll take it out so you guys can see. I'm sorry, Janine, I'll put that back in again. I know that gentleman over there told me to do this, but it means we have to put it back in, which you don't like. Okay, so she's deep breathing. Give me some dip breaths and I'm going to get set up, okay? And if this weren't tiny, thank you.
Almost expected it to go flying.
He's all crinkled. This is what it should be. I'm looking at the strips. They're black. I know that it is sterile. Spooky. Just the outside I'm touching. We wouldn't have wanted that because it wouldn't have been scrunched. It would be like this. Only the outside. Remember what I said? This was my saline. Checking. Yep, this is saline, all right. This is what I want. Date, time, and initial is it is expired, or usually it's good for 30 days after opening. This has been opened, so I'm going to palm it. And where am I? Lip it, which means you kind of go like this, put a little bit off to get rid of the crusties. So I'm going to pour 30 cc's. And, or you could do 10 and 10. But being this is 30 cc's and not very big. And I'm going to pour, oh, this is terrible when you're an old person.
So they're both going to be saline?
15 and 15. So I'm only going to pour 15. Now I'm going to put hydrogen peroxide 15. Check again. This is brand new. I don't have to lip if it's brand new.
So you're basically just diluting it?
Yes. Never, 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 never. Well, it's not an open, but we don't use hydrogen peroxide anymore for cleaning open wounds because through tests they found that all it does is destroy tissue. Now, if you want to gargle it, where you're not an open wound, that's okay. Some people do that. Okay to do the skin, but you don't want to ever put it down there or drip it in there unless it is slightly diluted, but then you don't even want to. But at least if you dropped it in there, it wouldn't be pure hydrogen peroxide.
That stuff dry your skin out. Will dry the wound out.
Well, they used to use it all the time.
Yeah, I remember that.
You tell me he's not healed yet.
You don't put hydrogen.
Oh, that's not healed because you're a pansy.
It's still not healed. It's like a big scab.
So good as that though.
You want to open it from this way on back. You don't want to open this and then go back over your field and open this. You open this. All right, you know this is a little uncomfortable. So first of all, what I'm going to do is I'm going to clean the faceplate, under the faceplate. This is what's a little uncomfortable because you're messing with that faceplate. It's not so bad around the skin. It's the faceplate. Because I'm going to tell you right now, there's not a lot of room between the faceplate and the skin. All right, Shanae. Yep, looks like your oxygen's okay. Take some nice deep breaths, okay? I'll try to be off as little as possible.
Thank you.
First of all, I'm going to put saline. Lift up the faceplate. Like I said, guys, you don't have a lot of room. This is why it's pressing on them. You want to go from inside out under the faceplate. I'm cleaning under here, not the skin. And I'm going one swipe out. One swipe out. Now, going to use the peroxide. You don't want it dripping, because you don't want anything to drip in there. She'll start coughing up a storm. Now I'm going to do the saline on this side. So I'm using that side and this side. So I did saline, hydrogen peroxide. Now I'm going to use this to dry. Take some nice deep breaths, okay? You don't want to touch the inside because it's dirty. Okay, so under the faceplate, saline, hydrogen peroxide, dry, because you don't want that hydrogen peroxide to stay on there. Now I have to go around the stoma. It's called a stoma also. Right around it. I want to do the skin around. That's where all the crusties are. When they cough up, and it comes up from around there, and it gets crusty, and it gets really, really sometimes excoriated, because this thing is on so tight that it's like, ooh, hard to see under there. So you don't want the skin to get broken down. So that's important that you clean it at least, excuse me, once a day. Okay, so I'm going to do around the skin. So first of all, what would you start with if you're going to clean? Would I start here and go in, or in and go out?
In and go out.
Yes. Because here you want to move it out. You don't want to move it in. So you want, first I'm going to start right next to the stoma. So I'm going to use saline, hydrogen peroxide, dry. Then I'm going to keep going out further. Saline, throw. Hydrogen peroxide, throw. Dry, throw. Until I get to where there's no more crusties and it looks nice and clean. So that's what I'm going to do in case you can't see. Okay, take some deep breaths, Shanae. You're doing good because your oxygen saturation. Always keep looking at that oxygen saturation. And, of course, her. Make sure she's not becoming cyanotic. She's not indicating any hypoxia.
If it starts dropping, you stop, put oxygen on.
Then you put it back on again. Yep, you got to stop.
And then once it returns, you can keep going. Okay.
I want to keep just those little cotton tips sterile. Saline. All right, remember this is the uncomfortable part. I'll try to do the best I can. Around right by the stoma, throw. Hydrogen peroxide, throw. Only one in there, it should be two. Dry. Throw. Now, get some oxygen. All right. And then I would have many more. Now, when you test out, I'm not going to have you have all these. Just as long as you show me saline, hydrogen peroxide, and dry. Then what you could say is with just one or two, you could do the next. Okay, take some deep breaths. Okay, good. Yep, sats are fine. I know that's uncomfortable. I'm trying to get done as quickly as I can. Then you go on out to the skin. And then you get another one, dry. Take some deep breaths. It looks much better, okay? Let me tell you, what's the worst thing is you get it all done. You put the new dressing on, and they have it coughing. And then all the mucus comes up. You got to start all over again. Now we're going to put your pants on. All right, I know. There's no way you keep it as sterile as you can, but it's almost impossible because this is so tight. You have to really work your way under it. Oh, I know. I'm trying to be careful because I know it's choking you here. But I'm trying. Pull it up over here. Okay, okay, okay. Now you can take some deep breaths. All right. Now I know we have to change that trach collar and we have to put these ties on because that collar is really dirty and all I have are these. So we're going to do it. Whenever you have twill tape, you have to cut it at an angle, especially for trachs. Then it helps it not fray. Because if it frays and you get those tiny fibers down in their lung, that's why you always use kind of 4x4s that we use. We don't use anything else. Anything that looks like it could have little strings and fray. We're almost done. You've been really good. Okay, your oxygen is getting better. When we were doing that skill, it kind of got down kind of far. So when that happens, just take deep breaths until I get the oxygen returned. I know I have a cold too, but I'm not infectious. Okay, I'm going to take this off. Hold it down. Just this part. You don't take the whole thing off. In fact, I think I'm just going to leave it on. It makes it hard. I know you're not going to be able to see. I was going to take it off so that you could see better, but then I'm afraid you'll get that in your mind. Okay, you can't remove this at all until you get the new one on, then you remove it. That's what I mean. It's hard to see, guys. Got to kind of hold it down, the faceplate, when you're doing this. Because what if you were doing the and the whole thing came out?
So it's got holes in it already?
Yes, okay. Yes. You could look at it a little bit better when you're practicing. You want to have it even. Both of them. You don't want to twist it. Go behind. Excuse me, Shani.
Is that the same hole as the other one, or is it different?
Same one.
The same one.
One goes in. I'm going to use the other one because it's cut better. I know, Shanae. If it gets really hard, you can use a little forceps. Okay, hold it down. I'm going to make this so it's one finger. You don't want it too tight, but you don't want it too loose. You want about one finger to go between. Then you take this, tie it in a slip knot. Sorry I'm on your face there. Now you remove the old. And it's Velcroed. If you need to. I have to tighten this a little bit. It's too loose. After I got that trach collar off, it was a little loose. You could cut this. You don't want all these string. Just at an angle. This will be thrown away. All right. How is that? I'll straighten this out a little bit. That man took your oxygen.
I moved it, but you threw it down.
Okay, take nice deep breaths. Let me look. Okay, you're getting back up there. Well, now it's nice and clean, and this will help. Then you'll start to have a whole coughing jag. All right, so we're going to leave you sitting up a little bit to help you breathe till you get that oxygen back again, okay? You're sat back. All right, anything else you need?
$9.
I'll leave these out, but they would be in there. Don't do it over your face. Wash my hands, get rid of all this. Keep her in an upright position, and you're done.